people in their 20s who are facing baldness issue. Why this sudden baldness issue in the youngsters?
Although the number of cases have increased, social media has played a very major impact in this case. There was an actor, and I did his hair transplant somewhere around December end, and we were talking about he got plenty of projects because of that hair transplant, and he was getting rejected because of his baldness. Basically, transplant is एक जगह से बाल निकाल के हम लोग दूसरी जगह पे डालते हैं, तो छोटे पौधे जैसा होता है। एक जमीन से पौधा निकाल दिया और वो पौधा रूट्स के साथ निकालते हैं ताकि दूसरे जमीन में हम डाल सके। वहां पे वो जब चला जाता है वो वहां ग्रो करना शुरू करता है, and that is simple concept of hair transplant. If a clinic is claiming कि our hair transplant is pain free, that is absolutely nonsense.
Have you had any cases where hair transplant has completely gone wrong and people then have come to you?
Even though the hair have grown, but they don't look natural. People have asked them कि ये wig तूने कब लगाया? Even after a hair transplant.
Kind of work that you're doing, God bless you and your team at the Infinity Aesthetics. Issues like male pattern baldness, hair thinning, hair fall, receding hairline has become really common. And we all want to take care of our hair fall and hair thinning. First of all, let me tell you, because of the treatments available, because of the advancements in medical science, this is a very solvable problem now. We have doctors like Narendra Nikumbh, who is one of the most renowned hair transplant surgeon in the country today. In this podcast, we spoke about how to take care of your hair health, how to take care of your scalp health, what should be avoided, why hair thinning, hair fall is on the rise. As we have mentioned in all our medical podcasts, through this podcast, we are trying to bring to you free consultation about your health. However, we strongly recommend that you go to your physician, your dermatologist before taking any advice from this podcast. Giving to you Narendra Nikumbh from Infinity Aesthetics Clinic on the iRonik Show. Enjoy. Dr. Nikumbh, thank you so much for joining us on the iRonik Show. So we had a celebrity skin dermatologist, Dr. Jayashree Sharad, joining us a couple of 2-3 episodes back, and we wanted to have someone to talk about one of the major issues that today's men face, that is hair fall, right? So first of all, sir, welcome to the show, and
Thank you for having me.
I have seen my friends try whatnot to have their hair grow again. Right.
Correct.
So they have tried a lot of things, lot of herbal pastes and all that they have applied to their scalp, and at the end of the day, have seen no result. Right. There are so many oils available in the market. There are so many hair products available in the market. Right. So we'll get into everything. Let's start. I will, before we even get into the biological reasons or the medical science of it, you have a lot of patients coming to you, right? And
Yeah.
I would believe the majority of them, I'm not, taking away the fact that many women today also face this issue of baldness. But
Correct.
I would like to believe that it's mostly the male that face this issue.
Correct.
So when someone comes to you, right, who are going through major hair fall, I mean, they have their hairline has completely resided. What exactly is the mental state of that person?
Yes. So, although the prevalence of baldness or hair receding or thinning of hair is pretty much common across both
Right.
the genders, but most of the patients who willingly walk in are males. So the thing about this is they are going through a very huge emotional turmoil. So depending upon the age they are in, the emotional turmoil or the emotional impact the baldness brings or even the thinning of hair brings to their life is very different. So just for example, if a boy is of somewhere around 18 or 20 years of age, the emotional impact that it has on his life is tremendous. He's going through too many things in his life. He is around his board exams, 12th board exams. He is either preparing for some competitive exams, or he is very early in his career. So what happens ki his focus entirely shifts because in the due course there's a peer pressure कि people misname themselves as uncle,
Yeah.
अरे uncle आ गया, ताऊ जी आ गया, या चाचा आ गए. So this is very much impactful on the younger ages. Similarly, if we move on to 25 plus years of age, in India, as commonly we can label it, 25 to 30 is somewhere around, we are very much career focused, or somewhere
Yeah.
around the marriages happen in India. On an average, I'm just talking about. So that brings another impact. So कई बार लड़की वाले नहीं बोल देते हैं. The
Mm-hmm.
person also feels himself as low esteem. He does not hang out with his friends. Is very hesitant about going out in the relatives also, because everybody keeps on just giving suggestions कि तुम ये कर लो, वो कर लो. And ऐसे ही सारी चीजें होती रहती हैं. If we move along to the 30s and early 40s, the pressure is quite different. So, by this age, majority of the males and even females have gotten married. 35 and 40s में होता यह है कि they start losing hair on a very profound scale. Even though the hair loss might have been on a slight scale in the 20s, but in 30s and early 40s, this can increase due to many reasons. Because diabetes, thyroid, and many other medical conditions also come in. So, in spite their 30s and 40s, they start looking 50s and 60s. So now the peer pressure is ki, how should I look young? So
Mm.
this is one of the impacts. Apart from that, in 50s, now the peer pressure nowadays, which I am seeing the OPDs, is quite different. Now, in their 50s, people start thinking about early retirement or retirement plans they start making.
Mm.
Now, what they want is ki I don't, even though I'm financially secured, I don't want to look my age. I just want to look healthy, and I just want to look young. Even though I'm young at
Yeah.
heart, I cannot look young on my face because of my receding hairline. So yes, uh, all these impacts, all these life impacts are very much troublesome in various stages of ages. And also, and as we know, in India, the pressure is majorly on females. So I would say just twofold this emotional impact in a female's point
I
of
can
view.
understand.
So
Yeah.
the females also experience a lot of emotional turmoil in case of balding or even hair thin.
So earlier, if you look at, I mean, even maybe 10 years ago or maybe 15 years ago, baldness was an issue probably which would come around in your late 40s or your 50s, right? And today, if you look at, it's not only people in their 30s, it's even people in their 20s who are facing baldness issue.
Correct.
Why this, sudden, baldness issue in the youngsters?
See, my take on this is a bit different. Although the number of cases have
Hmm.
increased, but the thing is, social media has played a very major impact in this case. Why? Because although people used to get bald or start losing hair in
Hmm.
their early 20s or maybe early 30s, a decade or maybe
Yeah.
before that, the social acceptance was quite okay. कि पीपल यूज टू थिंक हाँ अभी शादी हो गया, तो अभी तो बाल झड़ना पॉसिबल ही है, हो ही सकता है. So all these things used to be there. Like people used to have all these things in their mind, and that is why the number of turnouts in the OPD was not that much, because it was accepted कि हाँ हो ही सकता है. But आजकल because of the social media impact and the
Hmm.
impact the skincare and hair care industry has had on our young ages, the number of turnout has increased. So जरा सा भी हेयर फॉल हो जाता है, जरा सा भी कोई चीज होने लगती है, तो these people get very much conscious, and that is, I would say, the major reason for the number of turnouts in the OPDs. Second thing can be, which many studies have even proven, the quality of life, the stress the child or that person is going through, the dietary habits, the sedentary lifestyle, there's no activity at all in the lifestyle, the foods which we are having, fast foods ka culture बढ़ गया है, and that is why
Hmm. Hmm.
all these things have very minor impact. We medically call it as a chronic impact. So this type of impact is very minor impact, but in the long run it becomes a major impact. So although these people have predisposition to baldness, due to all these surrounding factors, it has started happening a bit earlier.
So one reason that you mentioned is stress, right?
Yes.
Obviously, lifestyle is another reason. So in all the medical podcasts that we do, lifestyle is a really common factor for
Correct.
all your diseases and disorders.
Correct.
So, but in today's, every we are so ambitious, right? So, stress is we are bound to have stress and tension.
Correct.
Tension and stress has become a part of our life, and this is something that will be there, and it's not something that you can just take it out कि आज मेरे को stress नहीं लेना है. It's
Correct.
not going to happen that way.
Correct.
So
Correct.
what all other factors are contributing to it other than stress and your lifestyle? Is there the weather that you have, where you're living, the pollution is a factor? Is
Correct.
pollution a factor for hair fall?
Yes, pollution is a factor. So, the smoke which gets out of your vehicles, the
Hmm.
industries which are polluting the atmosphere, they also have impact on the various aspects of your air quality. So, and the air which you breathe has impact on your body also. So, all these harmful oxygen radicals, free oxygen radicals
Hmm.
that we call,
Hmm.
what they do is basically mechanism wise, when they enter in your bloodstreams, what happens, the finest vessel, the smallest vessels gets impacted the most. And as you can understand, hair is already a fine structure, so the blood supply to it is already a fine or microcirculation, so the vessels starts getting constricted. So what happens, the blood flow to the hair starts also getting reduced. And this is the same reason why smoking also impacts.
This is another thing that I have come across in all the medical podcasts that we have done so far, or whatever discussions we have with medical practitioners, experts, that alcohol, they may say that okay, alcohol you can maybe on a weekend or occasionally you can have a couple of glasses of wine or whiskey. I mean, what I'm not promoting drinking, but I'm not promoting any alcohol product. But yes, they still allow alcohol maybe on a very occasional basis. But
Yeah.
smoking, all the experts are strictly, it's a strictly no for everything. Be it your diabetes, be it your other hormonal, like PCOS, PCOD in females, or your skin issues.
Correct.
Everyone says that smoking is a complete no, and I fail to understand why is that so. Is smoking so bad?
Yes. So I'll just give you a reference. If you look into if I'm not wrong, in
Hmm.
1960s or 70s, or maybe a bit in that decade, here and there, if you see how smoking started, like how it started becoming commercialized. If you look
Hmm.
at the ads in America, what these small cigarette companies used to do is, when there were no studies smoking is related to
Hmm.
cancers or any other lung cancers or any other things. So what they used to do is they used to actually pay the doctors, who were actually physicians and chest physicians. So what they used to do is these doctors used to come and promote smoking. They used to sit in their OPD while shooting the ads,
Wow.
and they used to promote smoking. It is only in the later half of 1960s or 70s, I guess, there were major studies found that it is directly linked with the lung cancer. It is directly linked with the lung problems. And again, as the researches went on for a couple of years more or decades more, they also found associations with other things. Now, the thing is, there's a very simple concept. When you smoke, there are nicotine and other free oxygen radicals that enter into your blood. Now, what they do is they have a negative impact over your blood circulation. What they basically do is they constrict your blood vessels. Now, the smaller the blood vessels, the major the constriction is, because already the organ is having very tiny bit of circulation. So, just for example, hair, let us consider hair since we are talking about it. So when these oxygen-free radicals or nicotine type of molecules enter into your microcirculations, they start getting constricted. Now, once they start getting constricted, the growth stimulus, the blood circulation, and the repair mechanism of that particular hair follicle starts going down. So if it gets damaged, it does not get repaired. So, I just want to add one more point to this. Ki people always say कि smoking is bad, but do you also know कि that passive smoking is even more bad? So, because
Okay.
say कि मैं smoke नहीं करता हूँ, but I just
Uh,
stand with my friends. But when you smoke, you are actively putting out the smoke. But when you are passively smoking, you are actually inhaling more smoke than when you are actually smoking. So, this type of lifestyle also has a major impact. Yes, so smoking has impact.
I had really thought that I will be talking about smoking towards the later half of the podcast, but since we are already talking about it, let's get deep down into it. So
Correct.
today, I mean, if you look at smoking, I mean, normally I would say majority of the scenarios, it starts as a macho thing when you're a teen,
Right.
right? It starts as a macho thing. एक शौक से लोग start करते हैं. Then probably you see your friends, your colleagues, right, smoking. Then you start getting into that, you know, ki okay, let me have one, right? That one gets converted into 10. You don't even know when that happens, right? Then that 10 converts into one packet a day. Now you are a smoker. So what exactly my question is, when this happens, right? There are so many levels of smoking. One is passive smoking that you mentioned, which is equally bad for your health and overall skin or your hair.
Yes.
When you're smoking, if you're smoking one cigarette or 10 cigarette or a packet a day, what would be the difference that it would, I mean, how it will impact your overall hair growth or hair health?
See, the very सिंपल लॉजिक मेनी पीपल पुट टुगेदर इज
Hmm.
कि सर वो तो 5 पीता है दिन में या फिर वो तो 10
Right.
पीता है, मैं तो एक ही पीता हूँ, तो मेरा
Yeah.
हेयर लॉस क्यों हो रहा है? सो इट एंटायरली बॉइल्स डाउन टू द बेसिक कंसेप्ट कि वेदर यू आर प्री डिस्पोज टू हेयर फॉल. नाउ एज
Okay.
वी ऑल नो कि हेयर फॉल, आई वोंट से, as we all know that hair loss runs in family. This is a
Hmm.
very general conception that many people have. Now, if you're already a person from coming from a family who has baldness on your mother's or your father's side, and on
Right.
top of it, when you're adding to all these factors, you are smoking maybe one cigarette a day, but that damage is also a chronic damage. Let's say 10 cigarettes a day is damaging your
Hmm.
skin. This is all hypothetical figures. Let's say 10 cigarettes a day is damaging your skin 50%. It does not mean one cigarette a day is going to damage only 5%.
Hmm.
So the damage a cigarette or multiple cigarettes in a day cause over your body per se, not even skin or hair, entirely depends upon what medical conditions you have, what is the tolerance of your body, and how your body is recovering out of it. So you might have seen many people ki, for example, we are talking ki many people have
Hmm.
plenty of acne, but when they heal, they don't scar at all. Like
Hmm.
there's no pit on their skin. Similarly, there are many people who even get one or two pimples, but they get a khadda over their skin.
Yeah.
So this
Yeah.
is the way different body reacts to different damages to their body. So, one cigarette or 10 cigarette, obviously 10 cigarette is more damaging. But if that person who's smoking one cigarette is already predisposed to all these things, he will have major impact over his body than a person who is not having this predisposition and having 5 or 10 cigarettes a day. Obviously, not to say ki,
Right.
other damages would be there, but we are just constrained to the hair wala condition.
So it's the nicotine in the cigarette that is causing
Yes.
all this issue.
Yes, nicotine is one of the major things that causes damage.
So today's generation, the generation Gen Z that we call, right? Many people are moving towards vape, which is obviously not legal in India as of now. But
Correct.
we know that, I mean, there are so many things that are not legal but are easily available, right? So people are moving to vape because maybe of the taste or how it smells. I'm not too sure. But does it have equal, I mean, negative impact on your hair health or skin health as
Uh,
compared to cigarette?
there are many studies suggesting very negative impacts of vapes because vapes are naturally, obviously not formulated from a very natural thing. It's mostly a very synthetic chemicals that are used,
Yeah.
and that is why it is concised in that small bottle, and you can use it for multiple times and for a long
Right.
period of time.
Right.
So there are many studies suggesting very damaging effects of vaping also, and that is one of the basic reasons why it is not allowed in India.
So, Dr. Nikum, let me ask you one more question regarding smoking. You might feel that it's a very stupid question. We spoke about cigarette, we spoke about vape. What about BD? I mean, if you look at the look at the real Bharat, the rural part of Bharat, many rural part of India, most of the people smoke BD, which
Correct.
is again tobacco inside but wrapped in a natural paper. I mean, not paper, sorry, natural leaf. So, does it have the similar impact that your cigarette or vape has?
I would say it has more impact. Why?
Okay.
Because the way it is formulated, the way it is rolled or packed, it has no
Hmm.
filter to it. Plus,
Hmm.
on top of it, the constituents or the ingredients, it is not purified. So, as everybody of us know, it is packed in a very crude manner and it is just wrapped with a leaf around it. So, whatever you are smoking, the entire smoke without any filtration goes inside your body. So I would say BD is much more harmful than smoking. Not to say I don't promote cigarettes, but
Mhm.
BD is more harmful than a cigarette, I would say.
So what if someone quits smoking? So in maybe 6 7 months down the line or a year down the line, does it start having a positive impact on his body and overall, skin health and the hair growth?
Yes,
Does it?
yes. There are plenty of patients, like numerous patients, which after a good counseling have
Hmm.
actually
Hmm.
started losing on their daily cigarettes or even BDs for that matter. So I have seen very good impact over their skin and hair. The hair fall or the hair thinning which they used to have when they were smoking, that has gone down tremendously. The skin has started improving, the dullness over the skin, the pimples which
Hmm.
they used to have, the glow over their skin has increased. Yes, so quitting of smoking has a very positive impact. And this is
Okay.
what I've seen in my OPD also.
So let's get away from smoking. We had enough discussion around smoking. So we are not promoting smoking.
Correct.
It's your life choice. We are not here to give you gyan or anything. But
Yeah.
the only request would be that okay, smoking is not good for health. That's what I've understood from all the medical experts that I've spoken to. Okay,
Yes,
now get into.
I would just say to this is there's a reason why there's
Hmm.
a statutory warning printed over that product. You don't get statutory warning printed over a mobile or anything else,
Hmm.
but there's a particular statutory warning over a cigarette packet.
Yeah. So now let's get into what kind of hair conditions do you normally see. So hair loss is one, hair thinning is one, you have receding hairline. So what exactly is the difference between all these issues, and is there anything else that I'm missing out?
Yes. So there are very basic core differences in all these things. What we usually do is we irreplaceably use hair fall and
Yeah.
hair loss.
Yeah.
So let us define it a very general manner. Hair fall is when your hair just falls off, but a new hair grows at that place. That is
Hmm.
what we call as hair fall. But hair loss is when the hair falls and there's no new hair growing at that place. That is what is hair loss. And that is why the number of hair in hair loss start reducing on your scalp. But in case of hair fall, that is very temporary or semi-temporary, I would say,
Hmm.
depending upon the conditions you're facing. But that hair is usually growing back again. And that is what the basic difference between these two categories. Now, there are plenty of cases that we daily receive. Now, if you actually divide them, they can be divided as only hair fall and hair loss. There are plenty of other conditions which can be subcategorized between these two major headings. So,
Okay.
hair thinning is the start of hair loss. Or sometimes,
Okay.
some minor times, it can be a symptom of deficiencies or some ill effects of certain other diseases in your body. But it entirely depends upon your predispositions, कि whether this hair thinning will fall under a hair fall category or a hair loss category. Now, there are other types of hair losses also, like traction alopecia, you might have heard about. Now, just to clear the audience, alopecia is a medical term used for hair loss.
Hmm.
ठीक है. So when a hair is lost medically, it is known as an alopecia. So now whatever names I'm going to take,
Hmm.
it will have an alopecia in it because obviously it is hair loss. Sorry. So now there are different types of hair falls and hair losses. Now hair losses can be alopecia areata, where a particular patch develops over your scalp, like sudden loss of hair in that particular patch happens. It is an autoimmune condition, just like thyroid or PCOS. It is an autoimmune condition that can happen suddenly. Obviously, when you're predisposed to it, and sometimes due to some other reasons also, it may happen. Second thing is traction alopecia. Now, as we always see in our families, the older generation, they always, females specifically, they always tie their hair back. So the
Right.
thing is, their hair is always under pressure in this area when you tie your hair back.
Hmm. Hmm. Hmm.
So what happens? Ki the hair roots start losing their grips, and ultimately the hairline starts receding. So that is traction
Yeah.
alopecia. The third category, and which many people are concerned about nowadays, is androgenic alopecia. That is male pattern hair loss or a female pattern hair loss. So that is what typically we always majorly see, I would say, कि my hairline is receding, यहाँ से मेरा बाल जा रहा है, एकदम सब तरफ से ही जाने लग गया. These are different patterns of hair losses. Whereas if we consider hair fall can be due to many reasons. First thing is deficiencies in your body. Now, if you are a vegetarian, you are more prone to have B12 deficiency. B12 has impact on iron carrying capacity, and that is why your hair can be falling. Sometimes, due to nowadays sedentary lifestyle, the vitamin D exposure is less. So, vitamin D deficiency can also lead to hair fall. Pregnancy is one of the major factors post which females start losing hair fall. Menopause, hair fall is there. If you are ill for some time, let's say if a person gets a typhoid, malaria, or dengue type of fever, which is considered as a major thing for a body, then also there's a hair fall known as telogen effluvium. So, many types of hair fall or hair losses can be categorized into two different categories.
If you have to put, if I have to just put into very simple concept, now let me take an example of a tree or a plant for that matter, right? So you see that sometimes the leaves of the tree, they just, because of overwatering or whatever it will shed because of the maybe during this autumn or spring when they shed their leaves, right? So during particular time of the year, trees will shed their leaves completely, right? So that new leaves can come up.
Correct.
Is that also the reason of a hair fall? Maybe your hair is, I mean, what is hair fall? I'm trying to just, so
Acha.
that you are losing one strand of hair, so a new hair is growing out. So that is considered as hair fall.
Fall. Correct.
Okay. Now, hair loss would be something when a strand of your hair or maybe multiple strands of a hair, you lose out on, suppose, thousands of hair strands. In that, but there is no, what do you call that?
New growth.
There is no new growth.
Correct. Correct.
It could be because of your, as you mentioned, that various other lifestyle that we have. So the basic reason is that your roots of those have become weaker or have completely, died off, so that they are not able to produce new strands of hair. Is that
Correct.
right to say?
Yes, but the reasons can vary. So the thing is,
Hmm.
hair loss has many reasons. One
Hmm.
of the major reasons that we know about is DHT, dihydrotestosterone. So you might
Okay.
remember this term from DST blockers, which many medicines come up with.
Hmm. Hmm. Hmm.
Second reasons can be some trauma to that hair, just like what I said, keep the traction alopecia.
Hmm.
So
Hmm.
constant pull over that hair also loses its roots grip over the skin, and that is why it is also it gets also lost. Third reason can be some injury in that area. Ki your root
Hmm.
is damaged and now it cannot grow back.
Hmm.
So the basic reason is hair fall can be things which is a temporary thing. So once you cope up with your deficiency, once you get out of your illness and your body recovers, your hair will start growing again. But hair loss is something ki your root gets impacted. The DHT, dihydrotestosterone, has a constant impact over your hair roots. It starts thinning your roots and ultimately the root entirely goes away.
Let's speak
So,
about this DHT thing, because
yes,
we are talking about male baldness. So I think
correct,
testosterone is that's what we all want. I mean, in a very simple, for our sexual health, for our reproductive health, testosterone is responsible. So
correct.
what do you mean by, I mean, is this a deficiency in testosterone? The levels go down and that causes hair fall? What it is?
So, I would explain, I usually explain this in a very simple concept.
Mm-hmm.
It is not the it is not exactly the levels of testosterone, but it is the sensitivity to testosterone. Now, just for example, there are two people
Mm.
clone of each other sitting side by side. They have
Right.
everything same. But if you pinch one person and if you pinch the other person with the same intensity, the intensity or the impact which both of them feel can be different.
Yes.
So, what happens genetically in our genes? There is some combination that predisposes our hair roots and makes them prone to this DHT, dihydrotestosterone.
Mm.
So, even if a person has higher testosterone and has no predisposition to hair thinning, will still do fine, will still have good amount of hair. But if a person has predisposition to your DHT and has even average level of testosterone, will start losing hair. So it is basically the sensitivity to the testosterone that dominates whether you're going to go bald or whether your hair will stay for a longer period of time. And that is why both males and females, although we call it as male pattern hair loss and female pattern hair loss, the
Yeah.
root cause can be this, the DHT, dihydrotestosterone impact over your hair root.
So please help me understand.
Huh.
Maybe probably I am. I have my own doubts. So when you're talking about DST and testosterone, dihydrotestosterone, right?
Dihydrotestosterone.
Testosterone. So does it mean your hair fall is also somewhere proportional to your sexual health? If you're losing a lot of hair, that is somehow your sexual health is also getting impacted because of your testosterone level. I mean,
No.
in the body.
No, no, no. It is not interrelated. So
Okay.
basically, if we can very generally classify things, it is
Mm-hmm.
not only one type of testosterone that circulates in our body. So there
Right.
are different types of testosterones that circulate in our body, which are responsible for different functions in body.
Hmm. Mm-hmm.
So the sexual function, the test type of testosterone which dominates the sexual function
Hmm.
depends upon the receptors that organ has. So, by that logic, like what you have
Hmm.
asked, if a person is losing hair, he might also be losing his sexual function. No, that is not true.
Okay.
His
Thank God.
sexual function can be entirely intact, but
Okay.
he can still be losing hair. Reverse is also true. Even if a
Hmm.
person
Hmm.
is having very good hair,
Hmm.
it is not a marker how his sexual life is getting impacted.
Right.
So both of them are two very different things, although they are controlled by your
Hmm.
testosterone
Hmm. Hmm.
things, but both of them are different things.
I was so worried because think of a guy who is losing out on hair. He's suffering. His mental health goes down. Now
Correct.
even his sexual health goes down. What would that person do? So thank you
Yes.
for clarifying that out. Okay. Now from on a very biological level, let's get into the reasons for hair fall, hair loss, hair thinning. So
Correct.
lifestyle is something that you've already mentioned, right? Lifestyle, your sedentary lifestyles, your pollution, the water that we are using, because most part of the countries we have hard water, soft water kind of things, which can still be prevented at a certain level, but they are also adding factors to your hair loss and hair fall. Uh, on a very biological level, is your hormone, your genetics, your genes, what you're getting from your either of the parents, is affecting your hair loss or hair fall?
Yes. So, your genes is the
Hmm.
basis of everything. So, how your body reacts, how your body recovers, and
Hmm.
how your body is maintained, it entirely depends upon what genetic coding you have received. And it is usually from your mother's side and your father's side combined. So genes forms the basis of everything.
Hmm.
Now, whatever other things are happening, that can be aging. So hair fall or hair thinning can also happen in aging. Even hair loss happens with aging. Your pregnancy matters. Keep post-pregnancy people start having hair loss or hair
Hmm.
fall. What medicines you are taking. Let's say if a person is diabetic since a very long
Hmm.
period of time and he has been on medicines since years or decades altogether, obviously that is going to have an impact because your body's recovery is hampered by diabetes. Similarly, if a person gets diseases such as TB, chest TB, or any other type of TB, if a person is on HIV medications, if a person frequently get malaria and is constantly on medicines, so all these things have a toll on body. So a very easy concept to understand is whenever a person gets ill, the thing is ki body needs to survive.
Yeah.
So body will conserve all those organs which are needed for survival.
Hmm.
So these are heart, liver, kidney, and all the main organs which makes us survive.
Right.
Skin and hair is not that important for survival. Like even a bald person can survive and a
Hmm.
person
Hmm.
with dull skin can survive, obviously.
Hmm.
So what the body does in certain this situations typically, what it does is it will focus majorly on your main organs. It will divert all the attention to the main organs. All the vitamins, minerals will be diverted to these main organs. And in this due course, your skin and hair gets neglected.
Hmm.
Now, body works on a feedback mechanism and reservoir mechanism. Every organ has its own reservoir. So let's say if a person falls ill, for
Hmm.
example, let us take malaria. If a person gets malaria and is ill for 10, 15 or 20 days, in this duration, body diverts everything to the main organs, and it completely neglects the skin and hair. But
Mm.
skin and hair will still be intact because they have their own reservoir. But once this reservoir is over and your body is still in recovery phase, after 1 or 2 months or maybe 3 months, you will start having dull skin, you will start losing hair. And that is what is known as telogen effluvium.
Okay.
So similar thing happens in pregnancy also. During the
Mm.
pregnancy when the iron and B12 and other folate supplements are going on, many females have very good hair, like they are very happy with their hair. But post pregnancy, post delivery, after 2 3 months, they start losing hair fall. So that is categorized as telogen effluvium. So all these things have an impact over your body. Also, one more factor that I forgot to mention, that factor could be your way of coloring your hair or the way of keeping
Mm.
your hair. So, if a person is constantly using heating devices, constantly touching up their roots, constantly coloring, highlighting, and putting all types of
Mm.
weird colors over their hair, this also impacts the overall health of your hair.
Okay. So, you mentioned that medicines can, hamper, obviously, because it's your, changing the kind of your hormones are also getting disturbed because of so medication and everything. And
Correct.
one point that you mentioned, particularly in ladies, now, I mean, gents are also doing it, tying up your hair so that it's putting pressure on the hairline. Now,
Hairline.
let me ask you one question. One point is that if I'm tying my hair, that's putting pressure on my hairline. People have the habit of going to salon and get those massages on hair, right? So does chumpy, what we call in really local language, or hair massage, does it also pose a threat to your hair fall, hair loss? Hair
So,
fall, definitely it can happen.
yes. So the thing is, there are 2 3 things happening at when you are doing a chumping.
Hmm, hmm,
So the first thing is very beneficial. कि whenever you're massaging your scalp,
hmm,
it increases the blood flow. So it helps your hair. But if it is a very violent or very vigorous massage,
hmm,
what happens is कि your hair starts breaking.
hmm.
So it's not always the hair fall, it is usually the hair breakage that happens during that violent massage.
Okay.
Now, if you're doing it occasionally, I would say that is fine. Keep once in 10 15 days or a month
Hmm, hmm, hmm,
duration, that is still fine. But if you are used to all this violent massaging, you are
hmm,
also putting traction that is pull over the hair. So whenever you're massaging, this traction is usually not marked or measured, I would say. It is very vigorous and very randomized. So some part of your hair can get a very major pull in that
yeah.
particular small square centimeter, and some
Hmm,
part of your hair will get very less pull. So it is that chronic damage, it is
hmm,
that chronic pull. If your particular side of the hair, if that hand is dominant of that person who
hmm,
always gives us massage, so that part of hair you will start feeling ki there's some traction alopecia happening. If this is a very frequent habit that a person has,
So one thing that you mentioned, that while if they are doing it properly, I mean, it can really help blood
it
circulation in the
helps.
scalp. We have always been told that we should oil our hair regularly and all those things. Many people put in oil and leave overnight.
Correct.
So Dr. Jaishe Shad, who is one of the leading cosmetic dermatologist, she was on the show a few episodes back. So one thing that she had mentioned, oiling, if you're oiling your scalp, your hair, leave it for not more than 2 3 hours, then wash it off. Don't
Correct.
leave it. Many people have the habit of leaving it for maybe overnight.
Hmm.
So she was talking in terms of skin health, because
Correct.
oil drips down to your face, your skin, and then you can have acne because it is blocking your pores. Now, is it recommended to leave, I'm strictly not talking about hair, strictly talking about your the scalp health. So is it recommended to have I mean, get oiling done and leave it overnight, or do you still, I'm being a dermatologist, I'm not talking about skin, I'm just talking here about the hair
Hmm.
health. Do you recommend leaving it overnight, or do you also recommend that you should wash off your hair maybe 2 3 hours after oiling?
Yes. So I would agree with Dr. Jayashree ma'am. So the thing is, It is the massage that has
Hmm.
more benefit than the oil you put.
Hmm. Hmm.
So most of the times I get asked कि सर कौन सा ऑयल अच्छा है, बादाम का
Hmm.
लगाएं, सरसों का
Yeah.
लगाएं, कैस्टर ऑयल लगाएं या फिर कोकोनट
Mahabhringraj tel,
Bhringraj.
Bhringraj.
Yeah.
Yeah.
So the basic concept, I'll just explain it in a very simple language. Oil is a fat. So fat
Yeah.
molecule size is very much bigger, and skin is made up of multiple layers.
Hmm.
What you are doing is whenever you're putting oil on the scalp, I'm talking about, it is not going to penetrate till the depth of your hair. And that is why that chumpy is required to just increase the friction in that area. So it will
Hmm. Hmm.
push it one, two, or maybe three layers down the skin. But anyhow, it is not going to reach till the very root level. So what
Okay.
happens is, usually when you do the chumpy, without any oil, it becomes very friction wala
Hmm.
thing. And
Hmm.
that is
Hmm.
why oil helps in that reducing that friction. But to think कि oil से मेरा बाल अच्छा हो गया है is very wrong. Now, the one thing that oil does very good and efficiently is moisturization and provides some minor nutrients to your hair. So, what I always recommend is gently massage your oil. There's no need to rub it very harshly or
Hmm.
very forcefully. Just gently massage your scalp with that oil and just leave it for 1 or 2 hours. Now, the thing is, what you can actually do is you can massage it on the scalp, but also massage it over the hair roots. Also massage it over the hair shafts. So what happens ki the oil gets a good coating over your hair scalp. So oil gets a good coating over your hair shaft, and it will give you that minor nutritive function, and it will also protect you. But if you leave it overnight, there are many things that can happen. If your skin is already dandruff prone, the dandruff is a type of fungus which feeds on
Hmm.
oil,
Hmm.
fatty food. It will increase. If you're already prone to seborrheic dermatitis or scalp psoriasis type of conditions, or very, I would say, folliculitis type of conditions, it is going to impact it negatively. So it will only increase the worsening of this all these conditions. So the thing is, leave it on for 2 3 hours and then you can wash it off. Now the other side of the story is, why do we say this, or why a dermatologist always emphasizes on not using it very frequently? Because our body produces its own oil.
Yeah.
So just like you have oil glands over your nose and you feel oily
Hmm.
every morning, like many people do feel like that. Similarly, there are oil glands over your scalp. So your scalp already has produced oil. On top of it, if you're putting excess oil and keeping it there, it may have that negative impact. So I would say it is not required, बट मेनी पीपल कमेंट से कि नहीं हमारे बाल फिर रूखे लगते हैं या फिर
Hmm.
वो और ज्यादा अजीब लगते हैं. सो देन दैट इज अ हैबिट यू हैव डेवलप्ड. इट इज नॉट रिक्वायर्ड, इट इज जस्ट दैट हैबिट. Once you follow it for 1 or 2 weeks, you won't even realize कि your hair is dry, because you will start realizing your scalp is already producing good amount of oil and your hair is getting coated.
So let me give my example to you. So I don't oil regularly, right? Still, if I don't wash my hair, if I don't shampoo my hair for one day, my hair gets really sticky and it feels
Correct.
oily, right? It's a natural oil that you're talking about.
Yes, yes.
So is it important to wash off that oil regularly, or is it good for the scalp and the overall hair growth?
Now see, everybody's body works very differently.
Yeah.
Now, there are some people who have dry scalp. Ki the oil production is quite low, I would say. Second category
Hmm.
is people are very comfortable. Ki even if they don't wash their hair or don't shampoo their hair for 2 or 3 days, they are still
Hmm.
fine. But then there is also a
Hmm.
third category ki whose feel their oil, their hair becomes sticky, like what you have mentioned, in one or
Right.
2 days only.
Yeah.
It does not mean that excess oil production is bad. Only thing is, this excess oil
Hmm.
production is bad when you have some medical conditions going on. Like if you are having frequent dandruff, if you are having forehead pimples all the time and you don't want them, so what you can do is you can wash your hair on alternate days. If it is very much oily, sometimes we also recommend washing it with shampoo every day. But that shampoo should be on a milder side just to cleanse your excess oil off and take off all these problems away. So yes, this is a very normal variation of people that oily scalp and mild oily scalp people have.
So I won't go much deeper into it. So when you say you can use a milder shampoo, so does baby shampoo count in that category?
Usually, yes, but not every baby shampoo
Okay.
is mild enough because, as we know, there are many factors to include in a shampoo that for it to be called as a mild shampoo. Fragrance is one
Hmm.
of them. So, what I usually recommend people using with sensitive scalp or people having excessive hair fall is rather than going for a mild shampoo, always look for a shampoo which lathers less, and that is how it takes away oil less from your scalp, but it cleanses at an
Hmm.
adequate level. Second thing, it has less fragrance. And third thing is, it has some conditioning effects. So your cleansing is efficient and not too much drying.
Dr. Nikum, let's now get into the main part of it, the hair transplant part of it. So you are a aesthetics and a hair transplant surgeon, right? So people come to you when probably they are really, feeling low at the one of the lowest stages of their life. They are losing their hair, and I would really, I mean, given the DNA that we Indians have, we go to the doctor when the damage is almost 80 to 90% done.
Yes.
We won't go before that, right? So when what on at what stage typically do the patients or these people come to you with baldness issue or hair fall, hair loss issue?
So I would divide them in two categories. One is very young age, who are very much bothered.
Mm-hmm.
Even if they start losing few strands
Mm.
a day, they will come and visit the OPD ki I'm going bald. Even if it is not even
Okay.
grade 2 or grade 1 for that matter. And the
Mm-hmm.
second category is, as you mentioned, कि जब तक वो बहुत लेट नहीं हो जाता है, they don't even bother. Like unless and
Mm.
until there's some emergency कि शादी करना है या फिर there is
Mm.
some major event going to happen, then only they come. So I would say somewhere around average, if I have to say, it's, grade 3 to 4 is the average when a person comes, baldness grade.
When we are talking about hair fall, hair loss, we spoke about how the root becomes weak and it is not able to produce new strands of hair. So, in a very medical term, can you explain how this hair transplant, how is this overall process done, and what do you do to, so that your scalp, your or the strands again starts to grow?
So, for a layman language, we'll just first explain ki, in a
Yeah.
day-to-day basis ki what is basically a hair transplant, and then we'll talk about the medical and the practical steps which we go through. So, basically, transplant is एक जगह से बाल निकाल के हम लोग दूसरी जगह पे
Hmm.
डालते हैं. तो छोटे पौधे जैसा होता है. एक जमीन से पौधा निकाल दिया और वो पौधा रूट्स के साथ निकालते हैं ताकि दूसरे जमीन में हम डाल सके. वहां पे वो जब चला जाता है वो वहां ग्रो करना शुरू करता है, एंड दैट इज सिंपल कंसेप्ट ऑफ हेयर ट्रांसप्लांट.
Yeah.
So if we are now talking technically about what are the steps for the hair transplant is basically first we evaluate the grade of baldness. If a person is of grade 3 baldness or let's say a grade 4 or 5 grade of baldness, the number of hair roots that person requires varies according to the baldness grade, and that is approximate grade, that is the approximate count of hair which we take, and then we extract the hair from the back of your skull. There's something known
Okay.
as safe area, so we extract it from the safe area and then we put it over this part. So that is a very general sum up of procedure that we do.
So when you say that you are plucking the hair from a safe area, so if someone has gone completely, I mean, bald, or even if that safe area does not have, much of a strand left, so what
Correct.
could, from where would you, take the hair? I mean,
Yes,
I have heard that it's taken from the armpit or the body chest hair, and even in certain cases from the pubic hairs.
correct. So
So how do you then match
basically,
that?
हाँ. So basically the thing is, as I explained earlier, it is a very simple concept कि कहीं
Hmm.
से भी रूट से निकाल दो और कहीं भी रूट के साथ डाल दो तो हेयर विल ग्रो. Now, the thing that there's a very technical detail to it.
Hmm.
So, if the donor area, this is what we call as donor area, we take the donation from here and then we implant it here. So, if this is depleted and there's no major number of grafts that can be extracted, the second priority area or donor area which we take it is from the beard area. And
Okay.
usually it is from the lower part of this beard. So
Hmm.
even if
Hmm.
we take some grafts from here, you will still have a beard which will cover that area. Second can be body hair. Now body hair can be your chest hair, your armpit hair. And in, I would say, very rare case scenarios, some people have also used pubic hair. But the thing is, the texture of these areas is very different from the
Absolutely.
texture of your hair,
Yeah.
scalp wala hair. So it might look a bit weird. So what we always try to do is, as far as possible, we try to keep our constraints till the donor area from the back, at least the front hairline. And whatever the hair we are taking from the body, be it from the beard or any part of the body, we always put it at the back of the head so that it gets masked properly.
Have you had any cases where hair transplant has completely gone wrong and people then have come to you?
Yes, there have been couple of cases ki people have done hair transplants from other centers,
Hmm.
and they have like gone very widely wrong. Now, there are two types of such people. One is ki their hairline is entirely messed up. Now, what happens is ki even though the hair have grown, but they don't look natural. Like they people have asked them ki ye wig तूने कब लगाया? Even after a hair
Yeah,
transplant,
yeah.
because the technicians or the particular surgeon who might have done that has not followed normal or natural skin hairline pattern. So the hairline pattern should look natural, and that is the first priority. Now there are other types of people also. Ki in their cases there is no growth. Ulta they have damaged the grafts. Ki they have taken plenty of grafts and here यहाँ भी नहीं बढ़ा और पीछे भी damage हो गया. So
Hmm.
now the thing is the only option left with them is partial hair transplant and wearing a patch at the back. So botched hair transplant is what I'm trying to refer to.
Why does that happen? I mean, does it depend on uh, जैसे हम कहते हैं ना कि किसी के हाथ का I mean if a same dish is cooked by two people, right?
Correct,
One is an expert chef and Michelin star chef, another is a really normal person who is just starting to learn.
correct.
Right. I'm putting it in very, layman term. So is it because of, I mean, you have the expertise or you have been doing it for maybe 10 years, 20 years, 30 years. So there is that expertise that you bring in to the table. And someone who is doing it, probably a new person who is doing it, or he is not, his skills are not up to that level.
Correct.
And because of, I mean, I would believe if someone is an expert, there is a financial, commitment here as well. Right.
Yes,
So
yes.
someone is trying to save money, and because of that, they are going to some place which is offering them a, let's call, cheap solution.
Correct.
So that's what I mean. That is where there is a concern that the hair transplant might not be, the work might not be as good as the patient would have expected.
Yes, yes. So hair transplant is not only a skill, but it is also an
Hmm.
art. So the reason for me to call it as an art is कि you need to follow some biological
Hmm.
milestones. So these milestones are natural looking hairline, and there are some intricate details regarding it.
Hmm.
The number of hair follicles in a particular square centimeter, which can mimic your natural hair density, the angle of your hair, the depth to which you put the hair root at. There's one technique called as no root touch technique. So all these things are learnable things, but the artistic touch that an experienced surgeon brings to the table is unmatchable. So now this artistic touch is what let's say a person's face is squarish. So
Hmm.
what type of hairline will look good over his face with the limited number of grafts that are available at the back? So this judgment only comes if the person has that artistic approach. Otherwise, what many people do is they just follow a casual procedure कि ऐसा hairline कर दिया, यहाँ पे डाल दिया, and हो गया. So it should also suit the face, and that is what the artistic approach is. Now, yes, there is a huge difference between a surgeon who has been doing it since many
Hmm.
years and the person who has just started. Also, there is a huge difference between a board certified surgeon and a non board certified surgeon who is just doing it for the sake. Also, there is a huge difference between a technician doing it and a proper doctor doing it. Now, there are some intricate details about it. Like many people literally just call us. Even today, we received one or two calls कि आपके यहाँ पे hair transplant का rate क्या है?
Hmm.
People just compare this. They don't ask
Hmm.
about the degree of the doctor. They don't ask about the experience of the doctor. They
Hmm.
don't ask for the results at all. They will just ask आपके यहाँ पे कितना है. एंड अगर किसी ने कुछ बोल दिया कि लेट से फॉर एग्जांपल एक डॉक्टर ने बोला कि हमारे यहाँ पे एक्स अमाउंट है, तो वो ही विल इमीडिएटली अप्लाई, क्यों आपका इतना क्यों ज्यादा है, वहां पे तो x-2 है. सो अल्टीमेटली अनफॉर्चुनेटली आई वुड से इंडिया में hair transplant has become a market, and there are many people compromising on many things and providing it at the least possible rate just to acquire that client. There is a huge difference between the quality of hair transplant you can get at a good center
Yeah.
than the quality you can get at a, I would say, cheaper center.
So if I have to really ask you, I mean, can you give us a price range that I'm not talking about a cheaper solution. If I am going to a good hair transplant surgeon, what
Correct.
would be a price range that one can look at that this would be the price range between which my complete hair transplant can be done. Obviously, it will depend on many factors. I'm
Correct.
not asking you to give a really specific figure, but can you give us a range?
Yes. So, just to give you that range, before that, I need to say a few things.
Yeah.
So, there can be a possibility कि a good surgeon is starting at a new place and
Hmm.
they might be giving some discounts. So, not to say कि if the range or the price quoted by that person
Mhm.
is lower than this range, he is not a good surgeon. So, just to give you a rough assumption, what a decent price should be, it should be ranged somewhere around 25 to 35 rupees per graft. This is a
Okay.
very decent range. Now, there are many clinics who can offer you cheaper than this, and there are many clinics obviously offering you more than this. Now, this 25 and 30 rupees, 35 rupees, which I'm talking about, is usually the per hair graft wala price. So,
Okay.
depending upon the baldness grade, the number of grafts required increases.
Hmm.
So, this is, I would say, the communication currency between, you can compare between clinics. So, 25 to 35 rupees per graft is a
So,
decent range, I would say.
so typically, maybe on the lowest side, what is the minimum graft that is required?
Minimum, that entirely depends. So, if a person has lost only very thin fringe of hair from this,
Mm-hmm.
so even 500, 600 grafts is required. So, now when I'm talking about grafts, we need to clear this also. So, when I'm talking about grafts, we are not talking about the number of hair. So, graft is basically the group of hair which grow together.
Mm-hmm.
So,
Okay.
example, on an average, what you can always do is you can multiply the number of grafts quoted by your clinic or center into 2.3. So, as you know, there certain hair grow as single hair, certain hair have two roots coming out together, and certain grafts have three roots coming out together. Now, even though there are three
Okay.
different hair, but if they are growing together, that is considered as a single graft. So if your hair transplant clinic, for example, is quoting you 1000 grafts आपको लगेगा, तो you just multiply it by 2.3 and you will get the number of hair that is going to get implanted. But commercially or financially, you will only be charged for number of grafts, not the number of hair.
So, my simple question would be, because you mentioned the procedure that you take from the donor area, you pluck the hair and put it into where it is
Implanted it,
required,
where it is required.
implant where it is required. So, does this procedure really hurt?
Now, this is a very subjective thing. I would say it is not very painful.
Mm-hmm.
But if a person or a clinic is claiming, like there are many things that are happening in the market currently, people are putting fake claims and other things. Maybe we'll talk about it later. But the thing is, if a clinic is claiming that our hair transplant is pain free, that is absolutely nonsense.
Okay.
The hair transplant can never be pain free. It can be less painful, but not painless. ठीक है, so why am I saying this? Because no matter what technique you will be using, ultimately you are going to puncture the skin.
Mm-hmm.
So depending upon the tolerance of your body, even if a person is, I would say, moderately tolerable, कि थोड़ा सा भी अगर स्क्रैच हो जाता है and you can tolerate it, you are not very much bothered about it वगैरह, And keeping fears aside, 0 to 10 के स्केल में I would say it is somewhere around 5. थोड़ा आगे या थोड़ा पीछे हो सकता है किसी लोगों के लिए. फॉर अ वेरी
depending on the
सेंसिटिव
tolerance.
पर्सन 7 या 8 हो सकता है. एंड फॉर अ इवन एवरेज गाय 4 या 5 इज अ वेरी गुड स्केल वेयर आई वुड पुट इट. सो
And
एंड
does it
दिस,
bleed?
हाँ, सो थोड़ा बहुत ब्लीडिंग इज एक्सपेक्टेड. अगेन व्हाई? बिकॉज हम पंक्चर कर रहे हैं स्किन को. तो स्किन में जो ब्लड वेसल्स हैं दे माइट ब्लीड, बट इट्स नॉट दैट कि धार लग जाएगा, इतना ब्लीडिंग
Hmm.
नहीं होता है.
Hmm.
इट इज वेरी माइनर, 1 or 2 drops वाला ब्लीड. So, no major bleeding. And the pain which we are talking about, that is usually in the initial steps when you are given the anesthesia. Once that anesthesia sets in, it becomes almost painless. After that, not in the beginning.
Okay. And suppose a person comes to you for a full, I mean, he's completely bald, right? Considering for the person is completely bald, how long does it take to, graft that his complete head? I mean, I would believe that it's not in single sitting. It would take multiple sittings to complete that.
Correct.
So,
So,
so how long would be the procedure?
Now this duration entirely depends upon the speed of that surgeon and
Hmm.
the skill sets of that technician, of those technicians which are sitting with the surgeon. So on an average, if a person is completely
Hmm.
bald, let's say grade 6 or grade 7, last stage of baldness, so that hair transplant can be completed in either 2 or 3 sessions.
Hmm.
Now every session, depending upon the speed, can last somewhere around 4 to 5 hours with all the breaks considered. Like if a person wants to go to a washroom in the middle of the surgery, he can still go. If he wants to have a lunch, all those breaks considered, I'm talking about somewhere around 4 to 6 hours every session.
The important question is once this grafting is done, when the transplant surgery is done, right? So what precautions the patient or the person needs to take care of? And second question is how long does he needs to, not follow the normal routine of, scratching the head or getting a simple oil massage or combing his hair or doing something else that we normally know in normal days do. So how long does it take for him to get to that normal routine?
Yes. So post hair transplant, now just like any other injury, even though it is a very precise injury, our body has its own clock. So even if we get some stitches done over
Hmm.
your body, it takes somewhere around 6 to 7 days for it to heal properly.
Right.
So this is the precaution which I always tell my patients. Ki what you do is for 7 days, you will have to take the utmost care, which I always give it in my sheet post hair transplant.
Hmm.
And that includes antibiotics, painkillers, swelling reducing medicines, and antacids. Plus, on top of it, from the moment your hair transplant is done and everything is dressed up, I always recommend them doing saline sprays. Now, these saline sprays are very important, and the person should always follow these saline sprays because that acts like a glue between your transplanted graft and your that puncture which is made in the skin.
Hmm.
So
Hmm.
it ensures that fusion is seamless. So your hair assumes roots, it gets blood flow very early, and it heals very properly. So if this instruction is followed along with some minor other restrictions, it usually takes 5 to 7 days, I would say, for that proper healing. Post that, the person can go out and do his normal chores with some restrictions. Now, the first thing that you asked about, I forgot about it. The first question which you asked.
Yeah, I was talking about what kind of preventions that which someone should take care of after the grafting.
Sorry. So, talking about that, so the most important instructions which I always tell my
Hmm.
patients is you should be taking work from home or a holiday for 5 to 7 days. Now, there are many hair transplant surgeons who might say कि नहीं इतना नहीं लगता है 3 4 दिन
Hmm.
ही
Hmm.
लगता है हम तो 3 4 दिन ही देते हैं. But the logic behind this is कि the biological healing clock of your skin.
Hmm.
Yes, your skin might heal in 4 days or maybe 5 days, but I still give my patients 1 or 2 days extra because you cannot predict
Right.
what conditions that person is living in and what type
Hmm.
of healing does that patient has. Now, there have been many incidences that have happened कि I have told the patient कि you should not be going out of home before 5 to 7 days.
Hmm.
and that person after 3 days went down in the society just for walking, and somebody put a dirty water over his scalp. Like nobody knows
Oh.
who is walking below, and वो पानी अभी किचन का था या फिर पौधे का था, don't know, but he's developed very minute I would say pustules, pus filled follicles, folliculitis उनको वहां पे हो
Hmm.
गया था, सारा स्काल्प पे पस पस डेवलप हो गया था.
Oh.
So these are certain things that have happened in the past and that can go wrong. आपके घर पे आपके सबको पता है कि आपका हेयर ट्रांसप्लांट
Hmm.
हुआ है, यू नो कि आपका हेयर ट्रांसप्लांट हुआ है, दैट इज व्हाई यू कैन टेक utmost care, but you cannot rely upon other people to do this. Similarly, other things that have happened with us कि पोस्ट हेयर ट्रांसप्लांट, ऑल्दो आपके स्किन पे
Hmm.
सिर्फ नंबिंग है, आपके ब्रेन पे नहीं है, योर डिसीजन मेकिंग इज नॉट हैम्पर्ड एट ऑल.
Right.
आप चल सकते हैं, आप डिसीजन सब ले सकते हैं, सब कर सकते हैं. सो देयर इज वन इंसिडेंस विच आई वुड से कि उनको हमने बोला था कि आप किसी को बुलवा लो एंड आप कैब से जाना.
Hmm.
So what happened is कि after that consultation of 45 minutes post hair transplant which I always take, वो बोल रहे थे नहीं सर मुझे तो सभी अच्छा लग रहा है, कोई प्रॉब्लम नहीं है, ब्लीडिंग नहीं है, मैं चल फिर सकता हूँ, आई कैन सी आई कैन जंप एंड अदर थिंग्स. तो आई सेड प्लीज ऐसा मत करिए. बट अल्टीमेटली नीचे जाने के बाद सो ऑब्वियसली मेरा ध्यान भी नहीं था एंड वी कैन नॉट डू दैट. सो ही बॉट समबडी ब्रॉट अ एसयूवी. तो एसयूवी में स्टेप अप करके चढ़ना पड़ता है थोड़ा सा. सो जब वो चढ़ रहे थे, सो जो दरवाजे का रिम था दैट गॉट ग्रेस्ड. तो उनका यहाँ के 25-30 ग्राफ्ट यहाँ से निकल गए.
Oh.
सो ये जो सारे इंस्ट्रक्शंस होते हैं ये हर क्लिनिक के थोड़े अलग अलग हो सकते हैं.
Hmm.
दिस कैन वैरी फ्रॉम क्लिनिक टू क्लिनिक डिपेंडिंग अपॉन द एक्सपीरियंसेस द सर्जन हैड एंड द प्रिकॉशंस द सर्जन वांट्स टू गिव यू. बट ऑन एन आई वुड से आइडियल बेसिस फॉर मी फॉर माय पेशेंट्स आई ऑलवेज रिकमेंड कि आप कहीं बाहर नहीं जाएंगे, आप खुद से कोई काम नहीं करेंगे, यू विल नॉट लिफ्ट हैवी वेट्स फॉर अ वीक्स टाइम, and you will spray the saline sprays at regular interval which we have prescribed. So touch wood, beyond these 2-3 incidences, all the cases which I have had have recovered very wonderfully.
My just a related question on this. कि suppose someone has got a grafting done. Now, क्योंकि आपने बोला कि फिजिकल एक्सरसाइज मना करते हो, आई मीन वेट लिफ्ट आप मना कर रहे हो. सो डज इट बिकॉज ऑफ द फैक्ट कि अगर वो वेट लिफ्ट करे या फिर कोई हैवी वर्कआउट वगैरह कुछ कर रहे हैं, देन स्वेटिंग से कुछ इशू हो सकता है?
No, sweating, see, in the first 7 days,
हम्म.
it's not the sweating ka problem because you are using saline sprays. So even if you're
ओके.
sweating, you are washing that away. It is
ओके.
the problem of that pressure. So the thing is, when you put pressure, so if you're lifting heavy weights, so your
हम्म.
blood vessels contract and they
या.
become the blood circulation in it becomes very tortuous. What happens? These wounds have not healed yet.
हम्म.
It can bleed, and
ओके.
this bleeding
ओके.
can push the hair grafts out.
ओके.
So, for those reasons, all the instructions given post hair transplant are around this only. Ki, you should not be lifting heavy weights, you should not be bowing down for a longer period of time. So, all these instructions are related to this. Ki, it should not bleed, your blood vessels should not become tortuous, and your hair graft should not be pushed out because they are very delicate. For example, if a person has done hair transplant just now, 5 minutes back,
हम्म.
and even if he does like this, plenty of grafts you will see in his hand. ये हाथ में निकल के आ जाता है सीधा. इट इज जस्ट पुट ओवर देयर. उसको हील होने में आपको हफ्ता भर देना ही पड़ेगा.
Is it not possible to have something around their head, maybe like a helmet or something that can just protect the scalp?
हाँ, so usually when a person goes out of the clinic, we
हाँ.
give a protective cap, but
ओके.
then you cannot keep it for a long period of time. Once you
हाँ.
reach
हाँ.
your home, you remove that cap because every, अभी depending upon various clinics, every 1 hour or 2 hour or 3 hours, you will have to spray the normal saline ka spray. So that cap is protected only when you are in the transit, when you are
हम्म.
going from the clinic to home, and when you're coming from clinic to home to clinic. Till in that duration, when you are at home, there's no need to wear any protective gear if you are staying
So
at home. And
is it
ideally, it is recommended to stay at home.
is it safe to say, let's say you are saying someone would say 5 days, someone would say 7 days. So
Yes.
let's take us really optimistic and really safer side that for 10 days you need to stay indoors stay, follow all the precautions or the whatever medications are been suggested by your surgeon, follow all those. And then after 10 days, the grafting is now fixed. I mean, it won't, just come up if your hand gets
नहीं.
brushed on your scalp, or if you just your, I mean, there is something that, touches your head, so grafting तब ठीक रहेगा, उसके बाद कोई दिक्कत नहीं
Yes.
है.
Nahin, nahin.
Okay.
So on
And
an average, this is 7 days. Why? Because on seventh day, we
हाँ,
call the patient for head wash. So
okay.
till 7 days, he is just spraying with that spray.
हम्म.
But on seventh day or let's say eighth day, when the patient comes at the clinic, we actually wash the head.
Okay.
So yes, so it becomes very much attached to the rest of your scalp and it becomes a bit resistant. But it is not that resistant कि आप खुजली कर दोगे या फिर रगड़ दोगे उसे. So it will take one more week for it to stay that way, like for it to become that resistant.
Okay. Okay.
But after a week, you can go out, you can resume your job, on-site job. You can wear a protective covering over your scalp and then wear a loose helmet. You can start doing your daily routine after 7 days.
And how long does it take for the hair growth to start?
Ha. Now, there are two scenarios in this case. There's one thing known as shedding. So, if you remember, we talked about that छोटा पौधे का analogy. And this is the reason why I always give that analogy कि छोटा पौधा एक जमीन से जब दूसरे जमीन में जाता है, अब दो चीजें हो सकती हैं. पहला चीज कि वो पहले मुरझा जाता है और फिर उसकी जगह पे अच्छा पौधा आता है. और दूसरा चीज, अगर सारी चीजें बहुत ही अच्छे से सही रही या फिर उसका ग्रोथ का स्ट्रेंथ उतना अच्छा रहा, तो बिना मुरझाए ही वो उगने लग जाता है. So similar things happens with hair, and that is why I give that analogy. So there are some people, I would say 10 to 15% cases जिनमें शेडिंग फेज आता ही नहीं है, कि बाल जो डले हैं वो 1 डेढ़ महीने में ही उगने लग जाते हैं.
Okay.
एंड मेजोरिटी ऑफ द पीपल, लाइक 80 to 85% ऑफ द पीपल, उनको शेडिंग फेज आता है. शेडिंग फेज यानी जितने भी हेयर ट्रांसप्लांट के बाल आपके डले हैं, दे ऑल शेड ऑफ, obviously in different days, on different days, some will come, some will go, but somewhere around 3.5 to 4 months is the shedding phase. So average, if I want to give, 3 to 4 months is an shedding phase. Post that, all your hair starts growing.
So around, say around 8 9 months, your hair will you will have a full head then if you're.
Yes, around 6 months only you will have a very decent hair. But the final result of hair transplant is somewhere around 10 to 11 months. Why? Because majority बाल भले ही 4 महीने के बाद उगने लग जाए, but there are certain few follicles which are weak, which require that extra stimulation. They grow after, let's say, 10 or 11 months. So approximately during 10 or 11 months is somewhere when we call this is your final result.
So just this hair transplant would be an extreme case when people have completely lost their. I mean, जो मैंने बोला कि people अभी I mean young people, they come to you at the very beginning phase, but most of the people will come to you when they have lost 80 to 90% of their hair. Now,
Correct.
are there medicines also available to promote hair growth?
Yes. So there are topical and application medicines and oral medicines also available to promote hair growth. But basic concept should not be forgotten, which many
Hmm.
people forget and many companies take advantage of this.
Hmm. Hmm.
So the thing is, hair regrowth is always with conditions. So if the hair root is alive, you can work on the hair. Again, that analogy comes in. अगर पौधे की जड़ें हैं तो आप उस पे खाद डाल सकते हो और कुछ ना कुछ उगेगा. बंजर जमीन पे आप कितना भी महंगा खाद डाल लो, कुछ
Yeah.
भी कर लो, अगर आप नया पौधा नहीं डाल रहे हो तो कुछ नहीं आएगा. सो अगर बंजर है तो ट्रांसप्लांट, अगर जरा सा भी पॉसिबिलिटी है, पतला भी बाल है, तो यू कैन गो फॉर दीज अदर ट्रीटमेंट्स अवेलेबल अपार्ट फ्रॉम हेयर ट्रांसप्लांट.
So what medicines are being normally given in today's world? I mean, जो अभी आप promote कर या फिर देते
See,
हैं आप?
there are plenty of medicines. Now, depending upon the causes of hair fall or hair
Hmm.
loss, their medicines can vary. If you are talking about topical medicines, application medicines, so many people might have heard about minoxidil.
Yeah.
So minoxidil comes in strength of 2%, 5%, 10%, and 12.5%. So minoxidil is one of the applications. Second thing can be Procapil, Bicapil, Ridensil, Capexil. कॉपर पेप्टाइड्स, एनागिन, ये जो सारी चीजें हैं, दे कम इनटू एप्लीकेशन फॉर्म, बट
Hmm.
इनका यूजेस एंटायरली डिपेंड्स अपॉन what type of hair fall or the causes of your hair fall are. Also, orally
Minoxidil.
भी medicines आते हैं. So, जैसे बायोटीन एवरीबडी नोज,
Yeah.
बायोटीन ले सकते हैं. अगर डेफिशिएंसीज है तो वो पर्टिकुलर डेफिशिएंसी को काउंटर करने के लिए यू कैन टेक
Hmm.
B12
Hmm.
और डी. अपार्ट फ्रॉम दैट फिनेस्टेराइड होता है, ड्यूटेस्टेराइड है, ओरल मिनॉक्सिडिल्स आजकल आ गए हैं. सो ऑल दीज मेडिकेशंस आर अवेलेबल.
आजकल ये जो कॉस्मेटिक कंपनीज में वो लोग भी काफी सारी ये सीरम्स वगैरह बना रही हैं
यस,
फॉर प्रोमोटिंग हेयर ग्रोथ
यस,
एंड नॉर्मली मैंने देखा है these serums also contain minoxidil, which you just mentioned. Most of these contain minoxidil.
करेक्ट.
So is there a side effect of minoxidil?
See, in medicine, there is a saying, if you are using it for a right reason,
Hmm.
there is a balance between risk to benefit. That is known as risk to benefit ratio.
Hmm.
Now, everything does not matter what type of medicine you are taking, be it of any pathy. Everything can have a side effect if it is not used for the right reasons and if you are overdoing it. So, topical minoxidil, if you are using for balding, hair thinning या hair loss, it is a very good medicine. If it is used in a proper supervision or proper prescriptional manner, it will have tremendous benefits. But if it is not used in that manner, might have some side effects. So ये जो क्वेश्चन है कि इसके साइड इफेक्ट्स क्या क्या हो सकते हैं एंड क्या क्या बेनिफिट्स हो सकते हैं,
Hmm.
दैट इज एंटायरली सब्जेक्टिव. अब वो आदमी किस चीज के लिए यूज कर रहा है. कई बार तो आई हैव सीन 15-16 year old बॉयज कमिंग एट माई सेंटर
Hmm.
एंड सेइंग कि सर मैं तो 6 महीने से मिनॉक्सिडिल यूज कर रहा हूँ एंड मुझे कोई फर्क नहीं पता चल रहा है, या फिर मैंने जैसे ही बंद कर दिया मेरा हेयर फॉल बढ़ गया. अब ही डिडंट हैव बॉल्डनेस इन द टू स्टार्ट विथ ओनली. तो मिनॉक्सिडिल वाई वर यू यूजिंग? नहीं, मेरे चाचा के बड़े लड़के ने बताया कि मेरे इसमें काम किया, तेरे भी इसमें काम कर लेगा. इट इज वेरी रॉन्ग. यू शुड नॉट बी यूजिंग मिनॉक्सिडिल कैसे भी. इट शुड बी अंडर प्रॉपर सुपरविजन, आई वुड से.
Now moving away from medicines. So जैसे आपने बोला कि डिपेंड्स कि कौन कर रहा है. इफ इट्स अ बोर्ड सर्टिफाइड डर्मेटोलॉजिस्ट, प्रॉपर एक्सपीरियंस्ड डॉक्टर, देन ओनली you should go for hair transplant.
करेक्ट.
Given all those things, everything is a patient is doing everything, is he's following all the precautions, he's following all the that has been prescribed, all the medicines. So is there still a slim possibility that hair transplant can go wrong?
In the rarest of rare case scenario, yes. Even if the surgeon has done his part, even if the
Hmm,
patient is
hmm,
doing all his part, sometimes it can, I would say, not go wrong in the wrong ways or negative ways, but the
hmm.
result might not be that much
Yeah.
perceptible, I would say, या appreciable. निगेटिव नहीं जाएगा यानी खराब नहीं होगा,
Hmm,
बट
hmm.
जितना चाहिए उतना रिजल्ट, एक्सपेक्टेड रिजल्ट शायद ना आए. ये होने का पूरा पॉसिबिलिटी है, यानी कुछ रेयर केस सिनारियोज में पॉसिबिलिटी
Hmm,
तो
hmm,
है.
hmm. So you are, I mean, the kind of work that you are doing, I mean, लोग आपके पास आते हैं when they're, I mean, at the mentally एकदम lowest stage पे हैं. Now
करेक्ट.
when this after 8-9 months जब full उनका growth हो जाता है, do people reach out to you that okay, doc, that आपने ये कर दिया, now I am confident, and how उनकी दिमाग पे क्या असर पड़ता है when जब ये अच्छे से किसी का transplant, when this gives a positive result, what is the effect on their psyche?
यस, इट हैज़ अ वेरी गुड इफेक्ट ऑन द साइकी. ऑलमोस्ट आई वुड से कि मेरे काफ़ी सारे पेशेंट्स दे रीच आउट बैक. एंड
Hmm.
वो ही नहीं, उनके फैमिली मेंबर्स आर ऑल्सो नाउ वेरी गुड फ्रेंड्स विथ ऑल ऑफ
Okay.
अस एट द सेंटर. लाइक उनके मदर्स, फादर्स, भाई या बहन जो भी उनको साथ में लेके आते हैं, दे आर ऑल्सो वेरी हैप्पी. आई हैव सीन सो मेनी केसेस कि दैट पर्टिकुलर गाय वॉज नॉट गेटिंग मैरिड बिकॉज ऑफ दिस. He got
Mm-hmm.
married. Now his family life is very much settled. He, यानी वो बोलते हैं ना, one thing less to worry about.
Yeah,
That has a major impact. Now he is worrying about
absolutely.
something else, और ये उसमें से
Absolutely.
नहीं है. This gives a very good satisfaction to us also and for them also. There are many people who are client facing. Their jobs are client facing. Uh, they get that boost of confidence. Very recently, uh, there was an actor. He stays in Andheri. I won't be naming,
Yeah, yeah.
but just 2 3 weeks back, we had that conversation. I did his hair transplant somewhere around December end, and we were talking about he got plenty of projects because of that hair transplant, and he was getting rejected because of his baldness. So क्योंकि पैच लगा के it is
Right.
visible sometimes, but that hair transplant thing gave him so much of the confidence, and it got him projects also. Similar things happen when it is very early, like I would say बहुत starting में जब hair fall हो जाता है कि 20 23 24 एज में, the person gets very much conscious regarding the interviews he is giving. He feels like there's something lacking in me, and the
Mm.
confidence level goes down. I have seen many patients of mine after the hair transplant, their confidence is such that यार, it shows on their face, literally. The smile does not go down at. There is no frown over their face, and they are so confident.
You're doing excellent work, doctor. Obviously, I know. I can understand that what kind of feeling that gives to you. Once the result, what the patient was expecting, once that is delivered by you, obviously they would be more than the money part of it. It's the blessings that would count,
Yes,
because there are many families who get hampered by these things. This is a major concern for many people, right?
yes, yes.
Okay. So one of the last questions. Obviously, everything is taken care, the medicine, the transplants, and all. If they're going to the right doctor, everything is taken care. But there are still a lot of scams that happen in this industry, right?
Correct.
Because when you're vulnerable, right, and this is one of the vulnerable points for a person, people are there to take benefit of that. What kind of scams are being played by the medical industry to benefit out of this?
Medical industry you're talking particularly?
Medical industry, or other people who are trying to scam. Basically,
हाँ,
अगर मेरा baldness हो रहा है, if I have to find out the right doctor and I somehow land up at the wrong
correct.
person's desk, what kind of scams are being played?
Yes. So let us divide it to two categories. One is scams by the pseudo clinics. I always call them pseudo
Yeah,
clinics. And one scam by the people who are selling you products,
yeah,
like the companies. So let's talk about the companies first. Uh, Very recently, I saw ad from a company, well-renowned company. They are just selling some hair graying, anti-hair gray oil, and some AI voice just keeps on claiming कि in 3 months you will get your gray hair darkened back again, which is so wrong. Even if you go to the best dermatologist, depending upon the reasons for your graying of hair, even he or she will tell you कि graying of hair may not be reversed. And these people are just claiming कि 3 महीने में your gray hair will be black again, otherwise we'll return the money. Now, as you know, from sales point of view, I don't want to go into details. From the sales point of view, this money back guarantee वाली जो schemes है, they never return the money due to some
yeah,
legalities and the loopholes. This has happened in Europe, and this has happened in America in the past. And there are many creators and YouTubers who talk about all these things. You can go through them. But the thing is, this is one of the very common scams that is happening. Another scam is hair regrowth. Since we understood कि अगर जड़ है तो बाल आएगा,
mm,
नहीं तो कुछ नहीं आएगा. But still there are companies who are running ads on a regular basis guaranteeing more than 90% of hair regrowth, otherwise money return. Again, I won't be naming the company. Everybody almost knows it. Third scam that can happen is these people are selling some oral products also कि सिर्फ लगाने
mm.
से कुछ नहीं होगा, हमारा ये मेडिसिन आप खा लोगे तो आपका बाल आ जाएगा, क्योंकि अंदर से काम करना चाहिए. What people should not forget is वही कंसेप्ट कि अगर जड़ है तो सब आएगा, जड़ नहीं है तो कुछ नहीं आएगा. So this is one of the major things which people are doing. इसके बाद में पार्लर्स में when you go just to sell the product, these people are selling. keratin procedures, cystin procedures for hair fall and hair loss also. So the first thing and the biggest lie which companies built is calling their procedures as treatments.
Mm.
So keratin, cystines are not treatments. They are just procedures, and chemically and heat use करके they melt your hair to make them appear smooth. And जिसने वो कराया है उन्हीं से you can ask after 3 to 4 months or maybe 5 months, 6 months, they will start feeling कि उनका बाल और खराब हो गया है and they will again go back to the same procedures.
Yeah.
So you keep on buying those things. You get into that circle. So this is one of the scams. Ab talking about the pseudo scams from the some pseudo clinics. So there are various claims कि हमारे इस टेक्निक से हेयर ट्रांसप्लांट कर लो तो आपका 1 महीने में ही रिजल्ट आ जाएगा.
Mm.
This is biologically not possible. If the wound itself takes that skin has its own biological clock of healing. That healing can be enhanced but not fastened. यू कैन जस्ट प्रोवाइड सर्टेन थिंग्स और वो हीलिंग अच्छे से हो जाएगा और बट उतने ही टाइम में होने वाला है. इट्स नॉट गोइंग टू बी हाफ ऑफ द टाइम. सो व्हाट दीज क्लिनिक्स विल डू इज कि इस टेक्निक से आप हेयर ट्रांसप्लांट करा लो तो आपका जो हेयर ग्रोथ है वो आधे समय में आ जाएगा. इम्पॉसिबल. सेकेंड स्कैम दैट इज हैपनिंग इज पीपल आर गिविंग लाइफ टाइम गारंटी ओवर देयर हेयर ट्रांसप्लांट्स एंड सम क्लिनिक्स आई हैव हर्ड आर गिविंग सर्टिफिकेट्स ऑल्सो कि लाइफ टाइम टिकेगा, which is not possible at all. Many studies have been done. हेयर ट्रांसप्लांट के बालों की भी एक लाइफ होती है, भले ही वो थोड़ी लंबी है. इट इज सेमी परमानेंट आई वुड से, बट इट इज नॉट परमानेंट. इवन वो बाल भी आपके धीरे धीरे कम होने वाले हैं. सो अंडर दीज डिसगाइजेस मेनी क्लिनिक्स चार्ज मोर मनी टू दीज पेशेंट्स, वल्नरेबल पेशेंट्स. Apart from
Mm.
this, there's one more scam that usually happens is uh, is a very old scam, I would say. Whether to call it a scam or just a misnomer, it is a legal thing to worry about. Anti-hair fall shampoos. So
Yeah.
this is a very common thing that happens.
Mm-hmm.
There's no shampoo. If you ask a proper dermatologist, they will always say shampoos never form the basis of treatment. Shampoos basically are just cleansers. And what you mean by an anti-hair fall shampoo is कि हेयर फॉल में आपको हेल्प करेगा. इट कैनॉट स्टॉप योर हेयर फॉल. कई बार लोग जब शैम्पू यूज करते हैं दे फील कि नहीं इस शैम्पू से मेरा हेयर फॉल कम हो रहा है. इट डज नॉट मीन कि उसने रोक दिया है और ये चला गया है. इट इज नॉट ट्रीटेड योर हेयर फॉल.
Mm.
इट इज जस्ट दैट कि मे बी देर आर सम कॉम्पोनेंट्स इन द शैम्पू विच आर लेस देन अदर शैम्पूज. फॉर एग्जाम्पल सल्फेट या बहुत ज्यादा झाग नहीं बना रहा है तो उससे सिर्फ बाल कम झड़ा है. डज नॉट मीन इट हैज ट्रीटेड द रूट कॉज ऑफ योर हेयर फॉल. And if you actually read ना, some companies which are very I would say थोड़ा एक step आगे जाके transparent होने try करती हैं, they always write anti hair fall shampoo and they will always put a asterisk marks there. When you go at the back and read about it, तो वहाँ लिखा रहता है in terms of hair breakage. So hair breakage is a different thing and hair fall is a
Mm.
different thing. Hair fall आपके skin से होगा और hair breakage बीच में से होगा. So this is, I would say, one of the very major and long-standing misnomer that has been happening in this industry. Anti-hair fall shampoo.
So my this is my last. We're coming to the end of the podcast, and this is my last question to you. We had a detailed discussion on what smoking does to your overall health, and
Correct.
mainly we are focused on hair today. So does alcohol also have similar effects on your hair?
See, alcohol, I would say, comparatively, if a person is
Hmm.
alcoholic, if he consumes major amount of
Hmm.
alcohol, yes. But if he is occasional consumer of alcohol, it is still
Hmm.
fine. But if it is under control, like under limits, I would say. So occasional is fine, but long-term excess is also damaging because everything that goes in your body has its effects and its side effects. So this that would be the case.
So it's like similar because I had a doc on the show who where we spoke about diabetes. So he has also mentioned the same thing that when you're if you're an alcoholic or if you're taking alcohol over the beyond the limits, obviously that's gonna affect your internal organs, your
Correct.
liver and everything. So that will anyhow have an opposite impact on your negative impact on your overall health. So I think that is the
Correct.
same case here. So
Yes, yes, yes.
thank you, thank you, Dr. Nikumb. Thank you so much for your time and explaining each and every aspect of hair transplant and hair fall in so much detail, and the kind of work that you are doing. God bless you and your team
Thank you.
at the Infinity Aesthetics. So thank you so much. I had a wonderful time and this was a brilliant conversation. Many people are looking forward to this podcast, I would believe. And personally, I also have a hair fall issue, so I have uh, gained a lot of perspective from this podcast and from your conversation. Thank you, Dr. Nikum, and I hope you too had a great time.
Yes, yes. Thank you for having me. And I also had a very great time, especially the questions you've asked got me into the many details of it. Thank you. Thank you for it.
Thank you so much, Dr. Nikum.